Hello, everyone. Today we will learn about the morphology of vertebrae. In childhood, the vertebrae are 32 or 33 in total, divided into 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, and 3 to 4 coccygeal vertebrae. After adulthood, the 5 sacral vertebrae fuse to form the sacrum, and the 3 to 4 coccygeal vertebrae fuse to form the coccyx, with a total of 26 vertebrae. A vertebra consists of an anterior short cylindrical vertebral body and a posterior plate-like vertebral arch. The vertebral body is the main weight-bearing part of the vertebra, and its interior is filled with cancellous bone. The posterior surface of the vertebral body is slightly concave, and together with the vertebral arch, it encloses the vertebral foramen. All vertebral foramina are connected, forming the spinal canal that houses the spinal cord. The vertebral arch is an arched bony plate, and the narrowed part connecting to the vertebral body is called the pedicle of the vertebral arch. There is a notch on the superior and inferior margins of the pedicle, which are called the superior vertebral notch and inferior vertebral notch respectively. The superior and inferior vertebral notches of adjacent vertebrae together enclose the intervertebral foramen, through which spinal nerves and blood vessels pass. The parts of the pedicles of the vertebral arch on both sides that extend posteriorly and medially and widen are called the laminae of the vertebral arch. 7 processes extend from the vertebral arch. 1. Spinous process. It extends posteriorly or postero-inferiorly from the midline of the posterior surface of the vertebral arch, and its tip can be palpated on the body surface. 2. A pair of transverse processes. They extend bilaterally from the transition between the pedicle and lamina of the vertebral arch. Both the spinous process and transverse processes are attachment sites for muscles and ligaments. 3. 2 pairs of articular processes at the junction of the pedicle and lamina of the vertebral arch. They protrude superiorly and inferiorly respectively, namely the superior articular processes and inferior articular processes. Adjacent articular processes form the zygapophyseal joints. After learning the general morphology of vertebrae, now let's learn the main characteristics of vertebrae in different parts. The vertebral bodies of cervical vertebrae are relatively small, with an oval cross-section. The transverse processes have holes called transverse foramina, through which the vertebral artery and vertebral vein pass. The transverse process of the 6th cervical vertebra has a particularly prominent tubercle anterior to the end of its transverse process, called the carotid tubercle. The common carotid artery passes anterior to it. When there is bleeding in the head, the common carotid artery can be pressed against this tubercle with fingers. For temporary hemostasis, the spinous processes of the 2nd to 6th cervical vertebrae are relatively short, with bifurcated tips. The articular surfaces of the superior and inferior articular processes are almost in a horizontal position. The lateral margins of the superior surface of the 3rd to 7th cervical vertebral bodies protrude upward, called the uncinate processes of the vertebral bodies. The uncinate processes of the vertebral bodies connect with the labial margins on both sides of the inferior surface of the superior vertebral body, forming the uncovertebral joints. If the uncinate processes of the vertebral bodies are excessively hyperplastic and enlarged, they can narrow the intervertebral foramen, compress the spinal nerves, and cause symptoms and signs of cervical spondylosis. The vertebral foramina of cervical vertebrae are relatively large and triangular in shape. The first cervical vertebra, also known as the atlas, is ring-shaped, without a vertebral body, spinous process, or articular processes. It consists of an anterior arch, a posterior arch, and lateral masses. The anterior arch is relatively short, with a dental joint fossa in the midline of its posterior surface, which articulates with the dens of the axis. The lateral masses connect the anterior and posterior arches. Each has an oval articular surface on its superior surface, which articulates with the occipital condyle, and a round articular surface on its inferior surface, which articulates with the superior articular process of the axis. The posterior arch is relatively long, with a transverse vertebral artery groove on its superior surface, through which the vertebral artery passes. The second cervical vertebra, also known as the axis, is characterized by a dens extending upward from its vertebral body, which articulates with the dental fossa of the atlas. The seventh cervical vertebra, also known as the vertebra prominens, has an especially long spinous process with an undivided tip, which can be easily palpated in a living body, and is often used as a marker for counting the ordinal number of vertebrae. The vertebral bodies of thoracic vertebrae gradually increase in size from superior to inferior, with a heart-shaped cross-section. The superior and inferior margins of their lateral surfaces have superior costal fossae and inferior costal fossae that articulate with the heads of ribs respectively. There is a transverse costal fossa on the anterior surface of the end of the transverse process, which articulates with the tubercle of the rib. The costal fossae of the first thoracic vertebra and the thoracic vertebrae below the ninth are atypical. The articular surfaces of the articular processes are almost in a coronal position. The articular surface of the superior articular process faces posteriorly, while the articular surface of the inferior articular process faces anteriorly. The spinous processes are relatively long, inclined postero-inferiorly, and arranged in an overlapping tile-like manner. The vertebral bodies of lumbar vertebrae are robust, with a kidney-shaped cross-section. The vertebral foramen is oval or triangular. The superior and inferior articular processes are thick and large, with articular surfaces almost in a sagittal position. The spinous processes are wide and short, shaped like plates and extending horizontally posteriorly. The gaps between the spinous processes are relatively wide, so clinically, lumbar puncture can be performed between the third and fourth lumbar vertebrae or between the fourth and fifth lumbar vertebrae. The sacrum is formed by the fusion of 5 sacral vertebrae and is triangular in shape. Its base is superior and its apex is inferior. The pelvic surface, anterior surface, is concave. The midpoint of the superior margin protrudes anteriorly, called the sacral promontory. There are 4 horizontal lines in the middle of the pelvic surface, which are traces of vertebral body fusion. There are 4 pairs of anterior sacral foramina at both ends of the horizontal lines. The dorsal surface is rough and convex. There is a median sacral crest on the midline, and 4 pairs of posterior sacral foramina lateral to the crest. Both the anterior and posterior sacral foramina communicate with the sacral canal, with the anterior and posterior rami of the sacral nerves passing through them respectively. The sacral canal is formed by the fusion of the vertebral foramina of the sacral vertebrae. It communicates with the spinal canal superiorly, and the foramen at its inferior end is called the sacral hiatus. There are downwardly protruding sacral horns on both sides of the hiatus. The sacral horns are often used as markers for sacral canal anesthesia. The lateral part of the sacrum is wide superiorly and narrow inferiorly. The superior part forms the sacroiliac joint with the auricular surface of the ilium via its own auricular surface. The bony surface posterior to the auricular surface is uneven. The coccyx is formed by the fusion of 3 to 4 degenerated coccygeal vertebrae. It connects to the sacrum superiorly, and its inferior end is free as the coccygeal apex. The above is all the content of this class. Thank you all.